So my name is Graham Barra, and I'm the director of an organisation campaign called Help, Not Harm. And I'm honoured and pleased for all of you to come here today, and I welcome you all. We have people who flew in from New York, from Wales, people, I came from Cork, it took me 3 hours on a bus, a long time, but I really appreciate you coming down on such an early event as well, 8:30 in the morning. Really, I don't think I can remember the last thing I got up so early for, and it really shows, I suppose, how serious people are taking this discussion. That if you're willing to come out, and take time on a Thursday morning to talk about this issue of drug policy, I think it shows that we've really grown up in the debate and we're really beginning to take it seriously. At Help Not Harm, we established ourselves in August of 2015. Paul Birch there at the back and Steve Moore, I met them at a study visit to the Catalan Parliament. And we talked for a little bit about kind of what the situation was like in Ireland. We've obviously made a lot of progression in social justice in 2015 here in Ireland, which, as a young person, I feel very proud, to say that I'm Irish and that, that I'm part of this kind of social revolution that we're having. Not even revolution, but more evolution, I think. It's not that we're trying to do things very differently here, like when we talk about drug policy in terms of social justice, it's just that we're evolving just to the next stage. So I'd just like to thank Paul Birch and Steve for coming together and thinking, well, what is it that we needed here in Ireland? We felt that we needed some coordination, in this movement, and that's something that I suppose we learned from other movements as well. And I think a lot of times when we talk about drug policy and the narrative around it, particularly in the media, we see harm reduction, education, recovery, policing, enforcement, supply reduction. And we think of all these things as mutually exclusive things, whereas in the reality, these are collaborations. These should all be part of the same kind of piece of the jigsaw, the same pieces, different pieces, but of the same puzzle. So I think it's really important just to remember that this is really a conversation to bring forward a coordination, rather than competition or being exclusive. So I think that's really important. So today at the symposium, what we wanted to do, we brought it here to Buswell's Hotel, to the doorsteps of Dáil Éireann, and we really wanted to have, I suppose, a discussion leading up to the general election. We'll start with a panel this morning looking at the failures, or basically kind of what we can do differently or what we can do better here in Ireland. What are the challenges that we face? And Comiskey is going to introduce that panel. Then we're going to move on and we're going to look at government efforts. We're going to see what are politicians trying to do, and then we're going to move on to what works internationally. What are the international experiences that we can learn from, and I suppose we can just experience together, and that we can evolve together. I think that's pretty much all I have to say for now. I'm sure if I forget something I'll come back to you later, but I'd like to introduce to you now Comiskey, the first panel, Failures of the Current Approach. Thank you very much.
Morning everybody, and thank you Graham for introducing me and for inviting me. I'm delighted to be here. So I'm Comiskey, Professor of Healthcare Modelling at Trinity College. But I suppose what really drives me is my passion for the research. And my research is all in substance misuse and people who use drugs. And I was appointed chair of the National Advisory Committee on Drugs and Alcohol back in December 2013. And it was great to actually move from being on the outside as a researcher to maybe being on the inside. It took me, mind you, 20 odd years, because how do we affect change? And I think change, it was lovely to hear you talking about evolving there, because I've actually seen over those 20 years how our drug policy has evolved and how it has been informed by strong service users, advocates, and by research. And so we need to keep moving forward and having the debates such as we're having today. I suppose before Christmas we actually met, and I had been at 3 different conferences, but all on debating substance misuse and people who use drugs. But the one that actually challenged me most was not actually a conference about drugs, but it was a talk by Emily Logan, who is our Human Rights and Equality Commissioner. And I started, because as an academic I'm always thinking, how can I improve and how can I learn? I started thinking, how is this challenging me? And it challenged me to think about what would be a human rights-based approach to healthcare for people who use drugs. You know, we're all in favour of human rights. You know, it's easy to say we're in favour of human rights, but when you say human rights for people who use drugs, well then if you're a drug user, a person who uses drugs and you're in prison, well what are your human rights in there? Do you have access to needles? You know, what are you getting the same treatment? And yes, we're working towards that. And you're talking about evolving. I mean, the research, people say, oh, we need more research, we need more research. I mean, research has been going on for, so it started 50 years ago in the States with Dole and Nyswander, who did the first clinical trials on methadone. And the reason they wanted to do those trials is they wanted to move away from this whole, you know, criminalizing and stigmatizing people who use drugs. And it wasn't, you weren't supposed to just give methadone to, you know, to reduce the harm, you wanted to improve lives. Then we had in the 40s, and we're experiencing this as well, 40 years ago, Hunt and Chambers, again in the States, used sort of public health epidemiology models to look at the spread of heroin use across the States. And now, I mean, we all know, and we're going to hear today, about the spread of people who use drugs across the country. You know, we move out of the cities into the regions. This is not something, you know, that we don't know about. We know about this from other situations. 30 years ago, we looked at treatment outcome studies started in the States where they saw that treatment works. 20 years ago in the UK, they did treatment outcome studies. Treatment works in the UK. We've done the Rosie study. I was very fortunate to be awarded that study, to do that study on behalf of the government at the time, looking at the outcomes for people who use drugs. And I can unqualifiedly say that treatment works. And not only does it work for the individual, but it actually works for families and communities. And not only, you know, does it work in terms of reducing harm, it improves society. So we need to be always moving forward. And now we're thinking, well, how can we do better? I mean, the research at the moment is showing that there's far more crime around a convenience store than there is around any drug treatment centre. Okay? And we need to remember that. So these are, you know, messages we need to get out there. So that's the research, but there's a human side to all of this as well. I work in Trinity College, but I'm actually based, I don't know if you know, the old gas building, the beautiful 1930s building, Art Deco building on Delir Street. And it has a bar beside it, and there's the old, it's called the Leinster Market, it's a laneway, do you know it? It's just, well, in the 80s it was the Heart Bar, you know, I mean, you know, I drank pints in there in the 80s when I was a student. But there's that laneway, and I had an office before I was the head of school, of course in the basement, and I could hear the people who use drugs who come into that laneway to have some modicum of dignity to either, you know, to inject their heroin. There were, you know, there were parents, there were fathers, mothers, children in buggies to try and get away from the street, to not be seen, not to be stigmatized and criminalized. There was nowhere for those people to go. They were hiding. And that, to me, is a disgrace. That is the challenge of a human rights-based healthcare. Is, you know, so those people would not be afraid. They shouldn't be afraid. There are injecting trials going on, heroin trials going on in London at the moment, and it shows that people they work. You know, better than methadone. The research is all there. The challenge is for us to change our thinking and be more human rights based and more human rights focused in all aspects of drug treatment. Kuhlmine launched a report this week, and I suppose that leads us very much into our next speaker, because one figure that struck me in that report was, even though they showed great improvements, I think there was 23, and it's not my report, I'm just remembering the figures, and I have a head for figures. It was around about 20-30% of people had acute and chronic housing problems at the start of treatment. At the end of treatment, it was still between 20 and 30. So, you know, there are things we can do better. And one other little story, I mean, I spoke there about, you know, Leinster Market and the lane and the people that I saw there. But, I mean, I'm also an academic, and I work with students all the time. It's what, I mean, I love working with my students. I tell them all, whatever age they are, they're like my children. I have this maternal, it's, you know, when you're an educator, you have a passion for that. But I mean, I do a lot of research projects and we have to get Garda clearance for all of our researchers. And I remember I had one particularly really good young lady who has a brilliant career in front of her. And of course the Garda clearance came back with, you know, had been cautioned or whatever for a joint at Electric Picnic. What was I to do, you know? Now, as somebody else might say, oh, well, you know, we're not going to have that person on the team. But of course, I wasn't going to say that. But that was down to me and my attitude. And there was this brilliant young, middle-class, educated woman doing her PhD who was going to make a contribution to society. I know she already is. But her whole career could have been actually interrupted at that point because she didn't have a clear Garda clearance. So those are the sort of challenges. It's not, you know, it's not just the working classes, you know, it's the middle classes as well. It's across all levels of society. So we really need to be looking at a human rights-based approach and enabling people to move forward. On that note, I've said enough. I would like to introduce our next speaker. I've probably actually said too much. Father Peter McVerry, who we all know, I've heard him speak before, another man of passion, and I'd like you to put your hands together.